情境跟 Part 2 Part 3 Rina。
你是演 Part 1的 Rina，是演 Part 1的 Dr. 我是演 Part 2跟 Part 3的 Nurse。
Rina is a 26-year-old health girl. Recently, she has had a fever for several days, not knowing the reason why. So she went to a clinic near her home, and the doctor gave her some medicine. After taking the medicine, her fever temporarily subsided, but after a few days, her fever returned. That night, it reached 40 degrees Celsius. So she came to the ER for help. The ER doctor examined her condition and decided for her admission to the hospital. Doctor admission interview for Rina. Good afternoon, Rina.
Good afternoon, doctor.
How long have you had a fever?
For about 2 to 3 days.
What have you been doing over the last week?
Nothing illnesses. I have no idea how I got this fever.
Did you take medicine for it?
Yes, but the fever has been coming and going. Now it's getting worse.
Besides a fever, have you noticed any other symptoms?
Yes, whenever it comes, my head aches, then I feel pain all over. I also feel cold, and I have been severe a lot.
What about a sore throat, runny nose, diarrhea, difficulty in urination, or blurred vision?
No, I don't have those problems.
You mentioned taking medicine. What medicine did you take?
I forgot the name, but it didn't work. My fever went up to almost 40 degrees Celsius last night.
40 degrees Celsius.
Yes, the doctor here says I have to be hospitalized because I could have sepsis.
Have you been abroad recently or in contact with anyone with a fever or contagious disease?
No, I haven't been abroad or in contact with any sick people.
Do you have pains or have you been bitten by any insects?
No, but I went hiking last Saturday. I fell out of a tree and got a few scratches on my feet.
Okay, please stay in bed. The resident doctor will come to see you soon. It's the first day of hospitalization. Rina has cellulitis in her lower right leg.
How are you feeling, Rina?
Although I don't have a fever now, I still feel uncomfortable.
Where do you feel uncomfortable?
My right leg is warmer than my left, and it is still swollen and painful to touch.
It usually takes 7 to 10 days for the symptoms to improve.
I know, I'm just worried that it will take forever to recover.
You don't need to worry.
Since I have cellulitis, will I be able to walk again?
Sure, it's a kind of local infection. As long as it's under control, your mobility won't be impacted at all.
Really, I'm glad to hear you say so.
Yes, and the antibiotics you are taking are the standard treatment for cellulitis.
Now I understand.
Let me help you let your leg to reduce the swelling.
Okay, thank you. Rina has been hospitalized for 5 days.
Dr. Yang has discharged you. You can leave after you have one more antibiotics injection.
Okay, where do I get the bill and the dangerous certificate. I need 3 copies of each.
You can go to the cashier for the bill, and I will tell Dr. Yang you need 3 copies of the certificate.
Great, thank you.
Now, could you repeat the things that you should do after your discharge?
Sure, first, meditation, good hygiene. It will help me avoid infection.
Yes, what else?
Lead a regular life. Don't stay up late or drink alcohol.
Good, and then?
Follow a balanced diet and make sure to take care of injuries right away.
Right. Remember to clean them with soap and water, and to put a bandage on them as well.
Okay, I will do so without daily.
Also, keep your feet clean at all times.
I will. Is that all?
Don't forget to take the antibiotics for at least 3 more days and come back for follow-ups.